So when talking about coronavirus and reducing the spread, I think one of the most effective ways to do that is using a mask. You know, there's some studies out there that are suggesting that it's possible to be infected and to be contagious without necessarily having symptoms or having very mild symptoms that you could attribute to just allergies or a minor cold or something like that. So by wearing a mask, you're reducing the chance that you could be inadvertently spreading that to someone else. As a physician, you know, since medical school, we've been wearing masks in a variety of settings, not just in the OR, but in a patient who has the flu or something like that. There's no compelling evidence to suggest that masks would somehow drop your oxygen levels or somehow be prohibitive to an otherwise healthy patient. There may be a subset of patients out there that do have a medical reason why they cannot wear masks, but if they're already to that point, these are people who should not be going out in public and interacting, because then they'd be at greatly increased risk if they were to contract the coronavirus. I think it's important that we focus on slowing the spread of the disease so that we don't overwhelm our capacity in the healthcare system. You've seen what's happened in New York and other places where you know, hospitals were getting overwhelmed, or like in Italy, for example, back in March, where the number of deaths was greatly increased because they ran out of ventilators, they ran out of beds. Currently at Shannon, we have adequate capacity to deal with the current demands of coronavirus, but if the entire population of St. Angelo were to rapidly contract it, that could pose some challenges. I think the vast majority of people who do contract coronavirus will have mild to moderate symptoms and not require needing to come in the hospital. But I think it's important to also focus on the potential spread from those people to the elderly or to the people who have compromised immune systems, who, if they are to contract it, it could be fatal. So I think if we can focus on not so much what will happen individually, but collectively, I think that could really aid us in the fight against coronavirus.